Now, the World Health Organization has delivered 22 metric tons of crucial supplies to help fortify cholera response efforts in Zimbabwe. A cholera outbreak in the country is suspected of killing more than 150 people and infecting more than 8,000 others. The current outbreak broke out in February of 2023 and has since affected all 10 provinces. Zimbabwe has since declared a state of emergency as it steps up efforts to combat the outbreak. Joining me now to tell us more is Dr. Hannah-Lisa Tetteh. Very good morning to you, Dr. Tetteh. Thank you so much for your time. Perhaps let's start off with the basics. What exactly is cholera and how does it affect one's system?
Okay, thank you very much for having me. So the basics is that cholera is an infectious disease. It's caused by Vibrio cholerae, which is a bacteria, and it's gotten mostly through poor water conditions or poor sewage management, and then sometimes through the eating of raw fruits and vegetables, and then foods that can be gotten from water, that's like shellfish and then seafood. And so if you're in close proximity with somebody who has cholera, you're at risk of having it because when they use the washroom or they release their stools, there's the possibility of the Vibrio cholerae or the bacteria being shed off. And then when you come into contact with it through how it was shed off, through water, through food, or through any other means, you can get infected as well. So basically, that is it. It's treatable, but it's just that sometimes it can be complicated and then it's quite a public health concern.
Treatable, I'd like us to touch on that shortly. But what we do know, as you and I speak, is that Zimbabwe has been grappling with a cholera outbreak exacerbated by the challenges. I mean, you make mention of water supply, sanitation and hygiene. With so many people suspected of dying of cholera as a result, I mean, we're looking at over 150. How should we now begin to assess the scale of the outbreak?
Yeah, so when the thing is that when there's an outbreak of a disease, especially, so since we're talking about cholera, when there's an outbreak of cholera, most of the time the focus is on the health aspect of it. So we are giving medications, we are trying to rehydrate the person, we are trying to treat them. But if the source is from poor sewage management, then the source is still there. And so it will keep increasing. If it's from poor conditions such that their water is really bad, then they keep taking and consuming the water and they keep getting infected. And so when we're looking at it in terms of management, I think that we should look at it on a broad scale rather than just in the hospitals, what is being done, how much medications are being supplied, how much vaccines are being given, and look at it on a broad scale. What are we doing to improve the water conditions in the environment? What are we doing to ensure that people cook their foods very well? What are we doing to ensure that the raw fruits and vegetables that people eat are clean and safe? So that's how we should look at it on a large scale, on a broad scale, rather than just as a public health concern or what the health department can do about it.
We know that the limited global supply of the oral cholera vaccines have further complicated response efforts, right? In a really pivotal move to fortify the response efforts in Zimbabwe, we've seen the WHO delivering a substantial consignment of these crucial supplies. How significant is this move in augmenting the capacity of health facilities to manage and treat cholera cases effectively?
So yes, I think that it's very effective. It could be very effective depending on how it's managed in a whole. In terms of the fact that, so when the vaccines are given, they are protecting the person who has been given the vaccine for a period. So then there are others as well. Are we going to manage the other conditions that are going to prevent the others from also being infected, such that even when there's a shortage, those who have been protected remain protected, and then we are preventing the others as well? Are we doing a full prevention, or we're just using the vaccine as our only source of prevention? So yes, it can be effective if we don't just use the vaccine, but we use the very basic things such as improving the water supply, making sure that they get good sewage management, and then they are able to eat, educated on how to wash their fruits and vegetables very well before eating, and not to eat undercooked food. So it should be on a general scale.
How will these supplies now empower healthcare workers on the ground who are grappling with this outbreak?
Yes, I think they will empower us a lot because, of course, when we vaccinate people or we treat them, then we have less people to worry about, at least for a period. And so it's very empowering that the vaccine is being provided. It's just that in certain places they are unable to afford, when there's shortage as well, they're not able to handle things well. So in places where it's going to be very effective, then we need to ensure that we give them as many as they need, and they were able to manage the vaccination such that we get a herd immunity. We get so many people being vaccinated such that the majority of the population is protected.
And you spoke a bit about, well, try to touch on treatment. What sort of treatment will this now take if one finds themselves with cholera and not too sure on whether they do have it until they get tested? What is the process thereafter?
Okay, so it's quite easy to know if you have cholera. Mostly you'll be having diarrhea, so you'll be passing loose watery stools, mostly 3 to 4 times a day, which is unusual for a normal person who's in good health. And most of the time the stools look milky. So you know when you rinse rice and water, the water that after you rinse the rice, that whitish water, that's how your stools look like. Some people have nausea or they feel like vomiting, or some of them actually vomit. Then there's a lot of dehydration. So you realize that you are very, very thirsty. Then your eyes can become sunken as well because you're losing a lot of water. Your eyes become sunken, your skin becomes very dry. And then you rush to the hospital because you're losing a lot of water, and that's what brings the problems. It's the loss of water that can lead to shock and sometimes kidney failure and then the complications. So then you know that you're losing a lot of water. So try and rehydrate. Drink as much water as you can. Try and rehydrate. And during that period, make sure that you're staying away from any raw food. If you can isolate yourself, that would be very great because most of the time, the closer you are to somebody with cholera, the higher your chances of getting cholera as well because you don't know where the person would have shed the bacteria. And so that's also what you can do. If you are with someone who has cholera, try and isolate yourself or try and get the person to isolate themselves whilst they seek help. Yeah.
As you mentioned the word isolate themselves, I can't help but do a comparative analysis on COVID-19 and cholera. And of course, deaths have also increased when it comes to the outbreak in Zimbabwe. Should we be concerned? I mean, what sort of measures should be taken as people move across the borders? Because that in itself could be a danger, especially since the screening cannot be guaranteed at the border. Because, I mean, it's not possible to ask a whole busload of people entering the country from neighboring countries to get screened.
Yeah, so I know this is something that has been discussed. Some people are for it, some people are against it. But you can't really fault a country for trying to protect its nationals or citizens. So yes, and cholera increases the more you are in proximity with somebody who has it. So if a country wants to close their borders or ensure that people who have cholera do not come in, I think that it's a measure that is welcome. But then the most important thing is if you are preventing the people with cholera from coming in, what are you doing to ensure that even if there's 1 or 2 people who have it, they don't spread it? Because it can even spread from 1 or 2 people. Remember, the outbreaks didn't start from so many people. It could have started from just 2 people. So yes, and as much as you're preventing people from coming in, you're preventing movement across the border, you can also beef up the screening process. Now, there's the rapid cholera test, which is very rapid. It can be done at the screening centers or at the points where they have it. Also, you can also get normal forms for people to fill or medical forms for people to fill. It's not everybody who's coming from a country with cholera that may actually have it. So you can get forms for people to fill based on their symptoms. Before they come to a country, they should have a medical report indicating that they do not have it. Or you can even insist that people who come into your country should be vaccinated as well, so that it's not a complete closure of the borders to countries because they have cholera. But then there are other things that can be done, such that even if somebody is coming from a country with cholera, they once they are protected or they've been certified to be protected or vaccinated, then they don't really need to be made to stay away from the country.
Yeah. South Africa is not barring anyone from entering the country, but what health officials have said is that they are going to be boosting screening at the borders, but it's not possible to screen everyone, and not everyone knows that they may be, suffering from the symptoms of cholera, which makes things even more complicated. What approach do you think needs to be taken beyond the immediate relief we're getting and seeing as a continent, especially looking at Zimbabwe from the WHO? Because what essentially has happened is an immediate response, but surely there should be some considerations on a more longer-term response and approach to dealing and containing the outbreak.
I honestly think that sometimes it's really sad that in Africa we have to complain or talk about having access to good water. I mean, I think that should be a basic thing that everybody should have access to. But sadly, there are certain places where they get their water from the streams, from the wells, and from rivers and lakes. And of course, those places, there's a higher probability of having cholera there. So I think that if we're looking at it, if we can, long term, if we can even get everybody one water pump at least to supply clean water, that should be okay in the rural areas as well. Then we should encourage people to have, like, we can build KVIPs, or we can build WCs, or we can build proper toilets so that people can actually visit there, and then there's good sewage disposal, and so that they don't have to go to the bush and then defecate there, such that somebody else can pick it as well, or they don't have to go to the streams and defecate there, then it gets into the water, and then the water bodies become contaminated, and then the fish. So you may think that because you are maybe in a capital city, you may not be affected, but remember that if somebody in the rural area has cholera, they go to the stream, they defecate, then the fish is infected, and then you bring it, and then you don't cook the fish well. It comes to the capital city, it's not cooked well. Then the spread is being taken from the rural areas into the cities, and then it's really going to spread. So there are basic things that we can do. Proper sewage management, good water, then education. We should have a lot. I think this is really good, but there should be a lot of advocacy as well, because so many people don't know what to do to prevent it or how to protect themselves. Something as simple as wash your hands very well with soap and water even before you eat. Don't eat undercooked meat. Avoid sushi, or undercooked meat. Or make sure that if you're eating fruits and vegetables, the raw fruits and vegetables, they are very, very well washed and well cleaned. So these are basic things that we can get to speak to people about. Now we have task forces that are in charge of ensuring that food is prepared and sold in the right places. But in most African places, you see that they're selling food by gutters, they're selling food in poor sanitary conditions. And if the task forces don't work to ensure that this thing is done right, then we may all end up getting infected. And that's what causes the increase in spread. Because like the fish example I gave, it can move from anywhere to anywhere. And so even if we close the borders or we prevent people from coming in, we're circulating it amongst ourselves. So I think these are the basic things that we can do.
Very well. Thank you so much for weighing in on this discussion. Dr. Hannah-Lisa Tetteh, Ghanaian medical doctor, there speaking about some interventions which are needed in the fight against cholera. Of course, as we take a look at the impact cholera is having on Zimbabwe, over 150 suspected cases in that neighboring country.